Welcome back. Well, right now, a lot of people may be focusing on eating healthier with those New Year's resolutions in full swing. With us to kind of help you along the way, though, is colorectal surgeon Dr. Rachel Martin. She's here to tell us why you need to make sure that fiber is included in whatever diet you're trying out this time of year. So we were talking in the commercial break, there's a particular not a disease, but a condition, I guess you can call it, that happens when we don't eat enough fiber. What is it called? And what is it? I don't want to butcher it, guys.
It's fine. It's called diverticulitis, and it's an inflammation in your colon. We all have about 6 feet, but there's a foot of our colon that can get infected just by the diet that we tend to eat, and westernized countries not having a lot of fiber in it. So part of my job with my patients to encourage them as they're going on diets to look for those foods that do have a lot of fiber in it to prevent those kind of issues.
And we were mentioning in that commercial break tease there that, you know, there are a lot of kind of fad diets out there right now. Some people are really seeing good results with some of these diets, the keto diet and other ones out there, but you're just saying that make sure if you do these diets, somehow find a way to incorporate fiber, correct?
Right, and there's a lot of good cereals that are healthy and can be incorporated in those diets that they do have a lot of fiber in them. So just look at the boxes. We're supposed to get 25 to 30 grams in our diet. Most Americans get less than 15. So
just something to think about right now. How do you know if you're already to that point where there is an issue in your colon? Obviously, there's probably some pain, but is that something that would be detected in your office, or how is that detected exactly?
So typically people come to me after they've already had a problem, and typically the problem is that they're starting to have pain in their left side. They may be having some changes in their bowel habits, and that's how they usually present to me. Unfortunately, a lot of those result in hospitalization. You can actually get a hole in your colon if the infection gets bad enough. And as far as, you know, why they're seeing me, sometimes it actually ends up in an operation.
And how often do you see this condition in your office? Is it pretty common?
It's very common.
Wow.
About 80% of 80-year-olds in America, it mirrors the age, have these outpouchings or diverticula that can get infected and cause diverticulitis.
So now's the time, instead of waiting to get to that age when it's become a full-blown problem, now's the time to start changing things. Pay attention to how much fiber you're taking in.
Exactly.
If people have any questions about this particular condition, any other colon or digestive questions, can they contact you?
Absolutely. I work for the Colorectal Surgical Associates of Birmingham. Our office number is 933-1199.
All right, thank you so much, Doctor. We appreciate it. Happy New Year.